Dr. Shetty, to Editor Speak. Is it okay if a doctor performs an intervention without informing the relatives at the request of the patient?
It is always advisable for a doctor to keep relatives and friends in the loop during an intervention. But if the patient insists on confidentiality, then we have to respect that. But for that to be true, the patient has to be an adult, he has to be competent, and he should be fit to give consent.
So what if a doctor performs an intervention without informing the relatives at the request of the patient and complications occur? Later on, if these relatives file a case of negligence, what will be the court stand in such a case?
If the patient insists on confidentiality to be maintained and the intervention is as per medical text and complications occur, the sympathies of the court may be with the doctor. In a recent judgment from the High Court, the patient was taken up for a cervical ganglion sympathectomy. The patient was hyperhidrosis. Complications occurred, cervical artery was injured. Patient became serious. He was transferred to another hospital and the patient died. The relatives filed a case of negligence against the surgeon. The court held the surgeon negligent on many counts. But one of the allegations made by the relatives stood out for me. They alleged that the surgeon had not informed the relatives about the intervention and they became aware of the intervention only when complications occurred. The surgeon in defense stated that the patient was a patient of hyperhidrosis from childhood. He had emotional upsets, he had suicidal tendencies, and he was afraid of his father. He was insistent that the relatives be not informed about the intervention. On the day of the intervention, he came alone. He was explained the risks and consequences and complications of the intervention. And he signed the consent form. The court on perusal of the medical record stated that the patient was 30 years old. Once he insisted on the relatives not being informed and he signed the consent form after the risks were explained to him, the surgeon was not responsible. The defense of the surgeon was accepted by the court and the court did not fault the surgeon on this count.
What would be your advice to doctors in such scenarios?
In our country, involving relatives and friends is always good. During an intervention and after intervention, as emotional support and social support. But if the patient insists on confidentiality and not informing the relatives, then we have to respect that. But for this, the doctor should specifically document this fact in the medical records and take an acknowledgement of the patient in the medical records.
Thank you, Dr. Shetty, for your valuable advice.
Thank you.